Hi everyone, this is Harshita. Welcome to Teddy Gets You channel. So today in this video we are going to discuss a very important topic, that is tuberculosis. Not only in pathology, it also very important in microbiology, and the drugs are also important in pharmacology, that is tuberculosis. We all know that it is caused by mycobacterium tuberculosis. Okay, for example, you are sitting in the OP, a person came to you with a chief complaints of fever. A patient came to you with fever, which is very common in many diseases: weight loss, chest pain, dyspnea, and cough. With these, if the person is having night sweats, make sure that you suspect tuberculosis, because the person is having weight loss along with the night fevers, chest pain, dyspnea. These are the clinical symptoms for tuberculosis, and the most virulence factor we can observe here is cod factor. Okay. Now let's go into the investigations. You met the patient and you are suspecting either it may be tuberculosis, and you sent the investigations like FNAC of lymph nodes, acid fast strain, and biopsy. Okay, in FNAC, like we have taken the aspiration. In that aspiration you can observe caseous granuloma, means the granuloma is containing caseous necrosis inside this, which is cheesy like material. Okay, it is a classical symptom of tuberculosis. Next one is you can observe the acid fast bacilli in Zn stain. There are many organisms that may lead to this. For example, they are Cryptosporidium, Isospora, and Nocardia. These are the organisms other than the Mycobacterium tuberculosis that can cause or that can be observed as acid fast bacilli. Okay, why this is happening? Because of the mycolic acid. Okay, and the last one is biopsy. You have taken a lung biopsy in which you can also see caseating granuloma and Jain cells. What type of Jain cells? Langerhans Jain cells can be observed. You also see heart shape or necklace. You can observe like this. This kind of nuclei, okay, this kind of nuclei, heart shape or necklace like nuclei in the biopsy. So these are the identifications in the investigation that you send to the lab. Next one is types of tuberculosis. There are majorly three types of tuberculosis. First one is primary tuberculosis, means first time the patient is getting affected. What kind of patient he is? He may be a child. Okay, as a child he is getting affected, hence it is called as primary. Next one is secondary, and the third one is military. Okay, let's understand them one by one. Okay, there is a child, for the first time he is exposing to the mycobacterium tuberculosis. Okay, it leads to the primary tuberculosis. Okay, this is a lung, this is the upper lobe, and this is the second lobe. Mostly the lower part of the first lobe and the upper part of the second lobe. Okay, these center lobe will get affected in the primary tuberculosis, hence this is called as Gons foci. Okay, the center part is getting affected, it is called as Gons foci. With the Gons foci, if there is involvement of any kind of lymph nodes, okay, then it is called as Gons complex. Focus with the involvement of lymph nodes, it is converting into complex. Okay, if there is involvement of fibrosis and calcification, these complex will convert into the Ranke's complex. And if there is the involvement of other organs like brain, liver, pulmonary veins, as if brain is getting involved, it is called Rich complex. Liver is involving Simon's complex. Pulmonary vein is involving Weget's complex. These are the other names that one should know. Second one, secondary tuberculosis. There is reactivation. Already the child is affected with tuberculosis once, and again he is affecting. There is reactivation, hence it is called a secondary tuberculosis. In children it takes place. This is clavicle, and the next part you should remember is this is clavicle. Above the clavicle supraclavicular, below the clavicle infraclavicular. If the lesion is above the clavicle, it is called as Powell's focus. If the lesion is below the clavicle, it is called as Asman's focus. Above it is P, below it is A. In the middle it is C, PCA. Okay. If it is above, it is called as Powell's complex, and if it's below, it is called as Asman's focus. And the last one is miliary tuberculosis. The name itself is saying there will be 1 to 2 millimeters of millet shaped nodules. So it is poor prognosis, and there will be involvement of other organs. The other organs will get involved because of this hematogenous route. Means the mycobacterium in the lung will reach to other organs like brain, liver, anything through blood, RBC. Through RBC, the disease is getting spread. So these are the 3 types one should know about the tuberculosis. So this is all for today. If you are not yet subscribed to the channel, please consider subscribing to the channel Teddy Guides You. This is Harshita. Thank you so much.